It's actually going really well. To be honest with you, it's been good because it's lovely that our patients have got their relatives and loved ones that can come in and share the care. It's really good from the relatives' point of view as well because it enables them to have an input in their relatives stay here and they can see what's going on, and it's helped out with the staff as well. It's taken a lot of pressure off staff, the fact that we have got that extra help. It was a concern with some staff, and I was actually one of them that did raise that concern, and it's worked out complete opposite. It's not a problem at all. It's been really helpful. We're having relatives and carers coming in, looking after their relatives, the patients, and having an input, and it's just really worked out well. I can actually, I can. We had a patient recently, he's not here now, and he needed care 24 hours, he needed someone with him all the time. It was really difficult with the staffing as it was, there was sickness and things going on. So his mum was lovely, she came in and she did the mornings and she would do everything for this patient. She made sure he was eating, make sure he was going to the toilet, and it was lovely. And in the afternoon then she would go, and that was her respite, and we would take over. And between the patient's mother and us, it really worked well.
Okay, so we very much look at the 24-hour approach of our patient's care here and what that entails from a therapy point of view. And having the family involved in that is really important. Things like stretching regimes, exercises, it's all very important that that gets carried out throughout the day. And sometimes we're not able to give that physio input throughout the day, so having families involved in that means that the patients get that intensity that they need for their neuro rehab. And going forwards towards things like discharge, families are very much going to be that first point of call for those patients, so it's important that they know how that patient is transferring, how their exercises are done and things like that. So yeah, it's all important.
Now, what I found with the flexible visiting hours is it means that different members of the family can visit at more suitable times. So people who are retired can actually come in during the day, and in the evening those who are working can come in. So it means that the patient has got perhaps more visitors than they would have otherwise.
Partnership in care is something that we've been doing a long time on St Peter's. Trying to involve families to come and be with their family members when they're here, doing activities, participating in their care, helping to feed them, even sitting with those that have some elements of dementia to enable them to relax and feel calm. Any support that we can get from families is really important in the rehabilitation of our patients.